In clinical practice, patients routinely integrate local cultural remedies, spiritual practices, and natural supplements into their conventional medical care. Yet these practices rarely appear on the official record. When practitioners utilize judgmental language when asking about alternative therapies, they create a barrier to disclosure. Fearing criticism, patients often hide their traditional treatments from their primary doctors. This creates a clinical blind spot, a gap in the patient history that prevents coordinated and safe healthcare. Consider the case of a 32-year-old mother. She is currently 12 days postpartum and visiting a community wellness center. Following traditional recovery routines, she is consuming Jamu herbal tonics and undergoing daily Urut abdominal massage. She presents with an acute 38.5-degree fever and escalating pelvic pain. However, she interprets these symptoms as part of a natural, traditional cleansing process and does not seek emergency care. This leaves the practitioner facing a hidden medical emergency, currently masked by a culturally normalized health tradition. To maintain patient safety, practitioners must separate the cultural meaning of a practice from its objective biochemical and physical risks. Navigating this requires a structured, culturally sensitive clinical flow. The primary objective is to evaluate safety parameters objectively without causing the patient to withhold information. Integrating cultural respect into the consultation provides the practitioner with the clear data needed for an accurate clinical assessment. The clinical flow begins with open inquiry and detail verification. Faith and cultural practices, such as Islamic prophetic medicine, provide patients with legitimate psychological and spiritual comfort during illness. The challenge for the practitioner is the pervasive natural fallacy. It is a mistake to assume that natural products are biologically inert or inherently safe. Botanical products and Jamu formulations contain active biochemical constituents and must be handled as unverified pharmacological agents. Verification requires precision. The practitioner must identify the exact plant species and the specific plant part used in the remedy. They must also confirm the manufacturing source and check for regulatory status, such as a MAL registration number. Finally, the record must include the exact dosage, the method of preparation, and how frequently the patient takes it. Without this specific data, the practitioner cannot accurately screen for organ toxicity or drug interactions. These details are then applied to Step 3, comprehensive safety screening. This process deconstructs the patient's behavior into 3 distinct threat vectors. The biochemical vector screens for herb-drug interactions. For instance, patients taking the anticoagulant warfarin face a high risk of bleeding if they also consume concentrated garlic or ginkgo extracts. The physical vector identifies contraindications in manual therapies. Practices like Urut or traditional bone setting require screening for skin integrity and deep vein thrombosis before manual pressure is applied. The systemic vector addresses the danger of delayed urgent care. We can see this vector in action with our postpartum patient. Her high fever and pelvic pain are not signs of a cleansing process. They are acute red flags. Clinically, these symptoms point to a systemic or uterine infection, such as endometritis. By opting for increased herbal dosages instead of a hospital visit, she is actively delaying a potentially life-saving diagnosis. Missing any of these 3 vectors can transform a supportive cultural practice into a medical crisis. Avoiding these crises requires a clear understanding of how health claims are evaluated, particularly in naturopathy and mind-body practices. A common error is to treat a patient's subjective sense of well-being as proof of a biological disease cure. Using a 4-lens evaluation, evidence, safety, culture, and regulation helps separate these categories. Patient experience covers subjective feelings of relaxation, comfort, or social support. When a patient feels calmer after daily meditation, they are reporting an experience. This must be distinguished from a measurable outcome, which involves quantifiable changes in clinical scores, such as a reduction on a standardized anxiety scale. Both are distinct from mechanism claims, which are biological or anatomical explanations that require scientific proof through research. Misinterpreting a feeling of relaxation as a biological mechanism can lead to dangerous treatment substitutions for serious physical pathologies. Returning to the postpartum mother, she is currently feverish and resisting medical referral. The practitioner must use a specific communication framework to resolve this. The 5-step response model provides a path: acknowledge, ask, advise, agree, and assist. The practitioner begins by acknowledging her values. I respect that you are using traditional care to support your recovery. This validation maintains the patient's trust, ensuring she remains open about her symptoms. The practitioner then advises on the medical reality. A high fever and pelvic pain are warning signs of a serious infection. They must state clearly that increasing herbal tonics cannot cure a bacterial infection and poses a risk to her health. Finally, the practitioner assists by arranging an immediate medical evaluation and ensuring the hospital doctor is briefed on all remedies used. This framework allows the practitioner to maintain a safe medical boundary while respecting the patient's dignity. The dual mandate of modern practice requires balancing cultural respect with strict clinical safety. Approaching patient beliefs with technical precision transforms cultural competency into a functional diagnostic instrument. Practitioners must take responsibility for screening for biochemical toxicity, physical trauma, and the delayed application of urgent care. By combining cultural respect with evidence-based screening, healthcare professionals eliminate blind spots and ensure coordinated, life-saving care.